Well, this time, let's talk health. Good evening to you, Lagos, and welcome to another episode of Practical Health Tips with Dr. Avon. This show is brought to you by Avon HMO. You can find them everywhere. You can reach out to them on social media. They're on Facebook, they're on X, formerly Twitter. They're also on Instagram at Avon HMO, or you can send them an email. The email address is practicaltips@avonhealthcare.com. Welcome. Today, we are discussing something that affects everyone, every adult in Lagos, and by extension, Nigeria. We're looking at no shame, just health. We listen, we don't judge. When was the last time you got tested for an STD? That's the conversation we are having today. And if it was many, many years ago, but you've been frolicking around with your organs, why haven't you gotten tested? Is it because of stigma? Well, we have Dr. Okafor here to talk to us about that. Good evening to you, Doctor.
Good evening.
How are you today?
Very well, thank you.
Good. I'm happy to have you here because this is such an interesting conversation. Let's start with the stigma around getting an STD test, especially because in this part of the world, adult people who have sex find it embarrassing to walk into a pharmacy to purchase condoms. Now imagine getting a test. Why is that?
It stems from moral judgment. You know, we are a society where we tend to be very judgmental, and sometimes that also stems from not knowing a lot, lack of education. So when people don't know so much, then they believe what they've been told. That may be misconception, something like that. So that carries on, and then it doesn't allow people to have open communications regarding STDs and to get tested. And like you said, to get condoms, which is one of the ways that you can prevent STDs. Like I said, lack of education, so people are not well informed. People do not know about STDs. People do not even know what are the common symptoms. People don't know that you can actually get tested. You can actually prevent it even as a as a teenager. And so because of that also promotes the stigma, if I should say that. And then
you mentioned earlier on that one reason people struggle with stigma is the lack of education. Let's talk about that for a bit, especially because I'd like for you to share some lesser known facts about STDs.
Okay, so lesser known facts about STDs. Not all STDs have symptoms.
AKA, they show for face.
Yes, exactly. They show for face. So you can have an STD and not have symptoms. Another lesser known fact is it affects everyone, regardless of your sex, regardless of your socioeconomic status. It can affect everyone. Then another lesser known fact is that it can cause complications.
How so?
So there are STDs that can lead to infertility, and these are very common STDs that can be easily treated. And if they're not treated over time, like I said, sometimes they may not show with symptoms, and then a woman is trying to give birth, and then she finds out that she can have a baby and all that.
Let's talk about some of those. Give us practical examples of some STDs that can in fact cause infertility.
Okay, so we have the common ones like chlamydia, which is very common, and usually we may not have symptoms. Some of the symptoms include vaginal discharge, which people can misconstrue for
because
a normal discharge.
Right.
And they may have pain. They can misconstrue that for cramps. And then some people can have burning sensation when they urinate, especially for men. That can be misconstrued for maybe a urinary tract infection. And because we have a habit of patronizing, chemists and all that,
pharmacies,
so they take antibiotics that would not address that because, of course, they've not been tested, and that can affect, their sexual health. And so, for women specifically, it can cause what's called tubal blockage. So that means you cannot have fertilization, and because of that, the woman, starts to have issues with fertility.
Yeah, so just a pointer here. If you're struggling with infertility, go and get tested for STDs. You never know. That's not to say you are wayward or you are just not moral, quote and unquote. It's just checking all the boxes. You've just mentioned some symptoms. Can we talk about other symptoms of STDs that people, again, may misconstrue and not necessarily find serious? And I'd like for you to hammer on the ones that you mentioned earlier.
Okay, so I did mention that you could have vaginal discharge, and you could have that could be associated with like itching, very intense itching. The discharge may also be have an offensive odor. Okay, then you could have pelvic lower abdominal pain, I should say. That could also be a pointer that you have an STD. Then, not to exclude the men, they can have painful urination rather, and then they have like discharge, like pus-like discharge from the urethra or from the opening where they urinate from. Then other common symptoms of an STD, you could have a rash or a blister. It may be painful or painless. That would differentiate between which STD it is. Usually for herpes, it's usually a painful blister, that you can have either on your genitals or in the mouth. Then your painless one, you can have that for people who've had syphilis. They can have a painless ulcer. Then you can have swelling around the groin area. So those are some of the common symptoms of STDs.
Yes, you mentioned that some of these symptoms don't show. You don't know, or you won't know unless you get tested. But between men and women, who are more likely? Which of the sexes is more likely to not present symptoms of STDs?
Okay, so because of the nature of the anatomy of a man and a woman, a woman is more likely to present with symptoms, and then she can now give that to transmit that to the man, because of just the nature. It's a shorter passage for urine, so that is. The bacteria has a shorter distance to ascend and then cause problems, unlike a man which has to travel further up to cause the infection.
Right. Let's talk about getting tested, which is the bone of contention here.
Yeah.
And you mentioned earlier that one reason people struggle with getting tested is the stigma around it. Let's talk about that for a bit. Why is testing important?
Okay, so testing is very important because first and foremost, it helps with prevention. Okay, and then like I said, STDs have complications, so it prevents complications, and then also it improves treatment outcomes. So, for example, I did mention that chlamydia can cause infertility. So imagine if a lady had gone for testing earlier on, especially because she has like risk factors. Maybe she has multiple sex partners, or she's unsure of her partner, something like that. And she did the testing and she knew that she had, chlamydia, treated that, she would have prevented, infertility down the line. So,
but after contracting chlamydia for so long, and now one is trying to get pregnant, is it still possible for a woman to get pregnant after having chlamydia for such a long time and is now undergoing treatment? Is that still a possibility?
Yeah, it's still a possibility, but it may be assisted reproductive, techniques for her to get pregnant. She may or may not be able to get pregnant the normal way.
How often should people get tested?
Okay, so the Center for Disease Control, their recommendation is that women 25 and below should, who are sexually active, should get tested, every year, at least every 6 months. They should get tested for chlamydia, gonorrhea. These are the common herpes. These are the common STDs that you have out there. Then also for I'm sure we all know that we can't rule that out. People who have diverse sexuality, men who have sex with men should get tested more regularly. People who have multiple sex partners should get tested regularly.
What about people who have just had sex for the first time?
Well, if you've had sex for the first time and you're not sure about the partner, or is a new partner, who you're not sure of, you should get tested at least 3 to 6 months. Yeah.
What are and of course we're going to say prevention is better than cure, safe sex and whatnot. But let's look at, broadly, let's look at the most effective preventive measures against STDs.
Well, the most effective preventive measure is still abstinence. Abstinence is still the most 100%, foolproof.
But we live in it.
Yes, so
we live in a society where people like to knack.
Yeah,
quote.
I understand. So, of course, you still have to preach abstinence. Then, of course, safe sexual practices like using a condom, and you want to be faithful to your partner, what you call mutual monogamy, with a partner that is STD free. You understand? And like I said, you want to use condoms. There are, for people who do oral sex, there are things that they call dental dams that you can use to prevent, especially for herpes. Then also you want to get tested regularly. So like I mentioned, you have to do your tests if you're sexually active. Then also you want to get vaccinated. I didn't mention you have human papillomavirus, which is
that's the HPV.
HPV, so teenagers can get tested earlier on. So not just females and guys, because you can give to the other person, and that can cause cervical cancer. That's one of the complications of that. So by getting vaccinated early, you protect yourself against cervical cancer. Then of course, perhaps the most important part is education. You have to know about the regular STDs, what are the common symptoms, and then how you can get treated. Right.
Let's talk about condoms. Okay. Right. What can you say to people who struggle with purchasing condoms? Who in fact would rather have someone else go and buy condoms for them than go in there themselves to do that? What would you say to such people?
I can understand their dilemma, I should say, and I think conversations like this help to make it easier for people to do that. But I would advise that your health comes before anything else, and then you should own up and then go ahead and purchase the condom.
Right, because you're an adult. Nobody is going to flog you. Even the person who is probably selling the condoms to you is doing something. Okay, everybody's got something. So don't be shy and don't feel embarrassed to get condoms. Let's talk about how healthcare professionals and the media can help, propagate the gospel of STD testing.
Yeah, that's very important. So for healthcare professionals, they need to educate the public. Then we need to provide like a safe space for people who have STDs or who have concerns around STDs to be able to walk into the hospitals. Like in developed countries, they have STI clinics where people come in free from discrimination, regardless of the age, whether you're a teenager and an adult, and they can come in and discuss. Then also, healthcare providers have to offer confidentiality. People should feel free, to come to a hospital and then discuss their health concerns, regardless, sexual health and all that.
Right.
And then for the media, we have to keep pushing the conversation against stigma. We have to also preach testing. We have to promote healthy, safe sexual practices. So those are some of, the ways that we can help.
Right. This show, Practical Health Tips with Dr. Avon, is brought to you by Avon HMO. You can find them everywhere on social media. They're on Facebook, on X, formerly Twitter, on Instagram at Avon HMO. You can also send them an email. The email address is practicaltips@avonhealthcare.com. Our guest today has been Dr. Frederick Okafor. Thank you so much for your time, Doctor.
Thank you for having me.
Someone says, I want to buy corn, then switch to cornflakes. Talking about the stigma. Look, we have to go. Thank you so much, Dr. Okafor. Lagos, that's the show. Until next time, go and get tested for STDs and do not be afraid to buy condoms because, as they say, sometimes, they show for face.